Bill Bunting at
What's going on,
HIMSS16.
man?
How's it going, brother? It's
Doing
good to
good.
see you, man. What do you think about it so far this year?
It's interesting. It's more compact than normal and easy to get lost.
Right? How do you compare it to last year?
Good event. I think the not being able to get around as easily to the sessions makes it a little challenging, but content's been great.
Yeah, I felt that too. Being spread out at multiple events, multiple hotels has been challenging.
Yeah.
Taxi lines, especially.
No doubt.
Right.
Welcome to Vegas. Always
Yeah,
crazy.
right. Yeah. It's just like Vegas here, isn't it?
It is.
Tell me what are some of the cool things that you're seeing evolve right now in the digital health, mobile health space, and what excites you, and what do you think are some of the challenges from your viewpoint as a thought leader in digital health? What do you see?
Yeah, so a challenge first. I think it all boils down to culture and people. It's not a problem that the technology doesn't exist. It's our willingness to accept it and adopt it and make use of it, and at the end of the day, use it to do what we're all here for, which is to take care of the patient, to engage them, to, better yet now with millennials coming up and even, use your mom as an example.
Right.
They're using technology to take control of their own health, which is great. So, as you start thinking about digital and mobile and what we can do with that, you start looking at things of telemedicine is hot right now, whether it be asynchronous or synchronous. Using live telemedicine to take care of a problem. You might have the flu, for instance, or using asynchronous video to communicate with your physician as opposed to having to pick up the phone and call them, which is great.
Right.
Or even better, I like to use the use case with asynchronous of imagine being able to get your discharge instructions and being able to share those with not only your family members, but those that are part of your care team. Which is great. I think some other hot areas in interest to me are mental health and what can be done with digital to, engage the patient, but also at the same time educate them. I think that's going to be huge in this space as well as adherence. Those are all hot topics.
What do you think some of the barriers are to this adoption?
I think most people would probably say it's a money issue, but honestly, I think it's more. We've become so ingrained in healthcare of doing the same thing day in and day out. And I know I posted a graphic on Twitter months back of, same old thinking, same old results. And I think that's really where we are in healthcare right this second. If we need these progressive companies to step out of the box and say, no, it's not okay anymore. Let's change the paradigm a little bit, do things differently, and really get back to basics of what healthcare really means and really putting the care back in healthcare.
Right, and so we're here at the Intermountain booth, and give a big hat tip to them for letting us be here. So when I look at the Intermountain Health System and the good work they're doing, I think I personally identify them as one of the leaders that are breaking out of the box, putting patients first, listening to what the patients say, and the whole user experience design. And who are some of the systems that on your radar screen is doing things different?
Yes, I think there's two interesting keywords there. One, design, and one involving the user, so involving the patient, involving the clinician. Intermountain's doing a great job of that. We've seen like Mercy do great things with telemedicine. We're seeing UPMC in Pittsburgh do some awesome things with investing in innovation. Kaiser Permanente and what we're seeing, the likes of someone like John Madison do around, building this whole ecosystem. Some really cool things that are out there, and I think, unfortunately, some of the bigger systems can afford to take the leap, but I think that at the same time, their market's big enough and they've got the incentive to really start using technology as an enabler to do more, and it's been fantastic to see them change what, the ways they've done things for the past 20 years and really get into this whole digital transformation bandwagon.
Right. Awesome. What's the one thing that you haven't done yet this year at HIMSS that's still on your radar screen you got to check off the list?
I don't know if it is Vegas, so what happens in Vegas stays in Vegas, but we had fun last night with some photos, but
that's good.
Maybe we'll hit the Sky Wheel tonight and see what we can do there. But
that'd be fun, man.
Yeah.
I hope I see you over there.
No doubt.
All right. Thanks, Bill.
Yeah.
Okay.
Appreciate it, man.
Okay.